So your doctor told you that you have a positive ANA test, and now you're wondering, what does that actually mean? ANA stands for anti-nuclear antibody. It's a type of antibody that targets the nucleus of your own cells. And while that sounds scary, a positive ANA doesn't always mean you have an autoimmune disease. Some healthy people, especially women, can have a positive ANA and never develop a health problem. But in other cases, a positive ANA is the first clue pointing toward an autoimmune condition. When an ANA test comes back positive, the next step is to dig deeper. Here are the series of tests your doctor may order to figure out what's going on. First, we look at the titer. That tells us how much antibody is in your blood. The higher the number, like 160 or above, the more likely it is to be meaningful. We also examine the pattern, which can give important diagnostic clues. Let's go over the most common ANA patterns seen under immunofluorescence and what they might indicate. Each pattern corresponds to different autoimmune conditions. Here's a quick guide. Homogeneous pattern, smooth, even staining of the entire nucleus, often points to lupus or drug-induced lupus. Speckled pattern, fine or coarse speckles can be seen in Sjogren's, lupus, MCTD, and more. Nucleolar pattern, bright staining of nucleoli, is seen in systemic sclerosis and polymyositis. Centromere pattern, discrete dots, suggests limited systemic sclerosis, also called CREST syndrome. Peripheral pattern, staining along the edge of the nucleus, often means active lupus. Cytoplasmic pattern, staining outside the nucleus, can point to myositis or primary biliary cholangitis. Multiple nuclear dots pattern, discrete nuclear dots, can be linked to primary biliary cholangitis. These patterns help your doctor decide which specific antibody tests to order next and guide them toward the most likely diagnosis. Next, the ENA panel checks for specific autoantibodies that point to certain autoimmune diseases. Anti-dsDNA and anti-M suggest lupus. Anti-RNP is seen in mixed connective tissue disease. Anti-SSA and SSB are linked to Sjogren's and lupus. Anti-SKL70 is found in systemic sclerosis. Anti-centromere indicates limited scleroderma. Anti-Jo1 is associated with polymyositis and dermatomyositis. Complement proteins like C3 and C4 can drop when your immune system is active, especially in lupus. Your doctor may also order other helpful labs. These include rheumatoid factor, anti-CCP, ESR, CRP, urinalysis, and a complete blood count and metabolic panel. In some cases, extra tests like antihistone or antiphospholipid antibodies may be helpful. A positive ANA is just the first piece of a larger puzzle. With the right follow-up testing and a full review of your symptoms, your doctor can better understand what's happening and create a personalized care plan. If you've had a positive ANA, be sure to talk to your rheumatologist and take the next steps. Thanks for watching. If this helped clarify ANA testing, give us a like and subscribe for more in-depth, patient-friendly health content.